Hello everyone, welcome to Ask Giri Physio Show, Season 5, Episode 1. Today's topic is the missing piece in the primary patient care. We're going to start this topic with the story of a patient, which I saw recently. This very active lady's safety officer used to go to gym 6 times a week. Then she had a labral tear in the right hip. Labrum is nothing but a cartilage, right? Cartilage tear in the right hip. And she had a lot of pain. She went to the primary care. They gave her some painkillers and they told her to take care of it. Pain didn't go away. She didn't do any exercises or any physiotherapy or any lifestyle changes. Pain was increasing. She went back again. She got a little more powerful painkillers. Pain didn't go away. She was very upset. She thought there's a big hole in her hip. Nobody explained her what the condition is about. Nobody explained her what to expect from it. Then more pain, more painkillers, more opioids. I saw this patient this week in our clinic. She came in a wheelchair. She's been in the wheelchair for 1 year. This diagnosis happened 2 years before. She came from an active person to a lot of painkillers, to crutches, to opioids, to wheelchair. She's in the wheelchair. This is just an example, a story of a real patient in our clinic. How this could be prevented, how this could be avoided. That's what kind of inspired me to do this episode. What is the missing piece here? Why this patient is in the wheelchair? How many patients are like this, going in this cycle, got caught up in the cycle? What should be different? What can we change as healthcare practitioners? The number one reason is pain neuroscience education. I'll repeat again. The biggest missing piece is pain neuroscience education in the primary care setup. I know when patient comes with the pain, it's easy to give pain medication and let them go. When the pain doesn't go away, how we have to handle that patient. Whether it can be a primary care physician or a nurse or a physiotherapist or whoever is handling that patient in the primary care when acute pain is there. The whole world, the physiotherapy world and the medical field is going from that pathoanatomical model to the biopsychosocial model. But still, some of us are stuck in the pathoanatomical model. That is the main problem, right? The other thing is, how much we are explaining about pain to the patient. Most of the patients we see, they think pain means damage. Pain means tissue injury. They're scared. They have a lot of fear, right? It's our job as healthcare practitioners to educate the patient about their condition, about their pain, about the necessity of movement and why it helps, how it helps, and removing the fear from their brain. Most important thing is we have to make a sense of pain, making sense of the pain to the patient, number one. What is a good pain? What's a bad pain? Why there is pain? Not all pain is bad. Why you have to move to take care of that pain? How movement can be a painkiller? How you have to sleep better? How you have to eat better? How you have to move better? All these things has to be educated at the front level. Because if you don't have time or if you're struggling to do pain neuroscience education with your patients, reach out to me. I have developed a lot of these modules like this, pain neuroscience education module with very, very small information patients can read about the fear of movement. I have a lot of modules like this for the patients. I will send it to you free of cost. Put it in all primary care centers and emergency units to educate pain to the patient, right? If you don't have time, at least give it to them to read and answer their questions. So as I said, number one approach is making sense of the pain to the patient with pain neuroscience education. Second thing is exposure with control. That's very important. A functional or movement exposure with control. Because people are scared of moving because they thought when they move, they get pain, they're going to get more damage. That's the mindset if they're not educated. So you have to expose them to movement and functional tasks with control. A graded exposure is very important, and that's where physiotherapy is coming in the role there. You got to refer to any healthcare practitioners who can do that graded exposure with control, with pain education, instead of giving them more and more painkillers, powerful painkillers and ending up in opioids. Because opioid crisis in Alberta is just increasing in a crazy amount. What are we doing as a healthcare practitioner? What are we supposed to do? This is exactly what we're supposed to do. Because the main reason for opioid crisis after the post-operative care is mismanaged orthopedic care. That's a very much reason, like back pains, neck pains, knee pains, hip pain. How many of these people are on opioids? Why they should be? There's no reason unless it is really, really needed. And the third component of the missing piece here is lifestyle changes, right? How many of us are talking to patients about that? Even as a physiotherapist, we are not fixers and healers, we are health coach. Are we talking to the patient about sleep? Are they sleeping well? Are they eating well? Are they moving well? Are they breathing well, right? Are they mindful? How is the stress in their life? and what kind of advice we can give them about that, right? All this lifestyle change is very important. So to me, these are the components of the missing pieces for a patient in primary care so that we can take them out of this pain opioid cycle to pain education, movement exposure with control, and lifestyle changes cycle. That is what needed in our medical practice from all of us, the whole team from the medical physicians to nurses to physiotherapists to chiropractor to everybody who's involved in this musculoskeletal health practice, taking pain away from the patient's mind and body so that they can lead a very happy life. So, functional wellness and lifestyle medicine is the way to go, along with pain education for this most of the orthopedic care when the patients have a lot of pain. So hope I got my message across, and this is very frustrating as a healthcare practitioner to see patients caught in this rut and the cycle and going to wheelchair for a hip labral tear. That is unacceptable. So let's all put our hands together and help these patients by doing proper pain neuroscience education and take them out of this rut and make them happy and make them have a good, happy, healthy, movement-based lifestyle. Okay? That's it. That's my rant for today. And if you need more from me, please reach out to me and check out my website, physioshow.ca. All our previous episodes are archived there. It's all free. You can just log in and check it out and then educate your patients. Do not forget, pain neuroscience education is to be on top of your mind when you are coming across anybody in musculoskeletal practice with pain. Hope we got the points across. Until I see you next, bye from Giri Srinivasan, registered physiotherapist, Ask Giri, the Physio Show's host.